Unit 4.1 Test Corrections. How does my body work and stay healthy? There are 4 topics: brain structures, blood flow, immune system, and the human reproductive system. The top portion of the brain is the cerebrum. The smaller portion to the rear is the cerebellum. Also pictured, the pons and the medulla oblongata. Together, these are the brainstem. The cerebrum has 4 lobes: frontal, parietal, occipital, and temporal. A good way to remember this is flower pot. F-P-O-T. Frontal, parietal, occipital, and temporal.
Atherosclerosis refers to a condition in which plaque gradually builds up in the wall of an artery. When fatty deposits containing cholesterol enter the blood vessel walls, immune cells are sent to the site to collect these fatty deposits and transform them into hard plaque. This causes the walls to thicken, meaning less blood can flow through them at a time. Atherosclerotic plaques are visible as bulges along the affected artery and can rupture and form blood clots within the arteries.
Blood flow and disease. How does vessel diameter impact blood pressure? Normal blood vessels are open and blood flows. When blood vessels decrease in diameter, hypertension or high blood pressure increases. The smaller the diameter, the higher the blood pressure. Which blood vessel represents someone who regularly participates in aerobic exercise? The normal or the atherosclerosis? How does consistent long-term exercise affect blood flow? Consistent long-term exercise will increase blood flow by reducing plaque and atherosclerosis. How does blood volume affect blood pressure? Blood volume is the amount of blood in the vessel. If the amount of blood is normal and the diameter of the blood vessel is normal, the blood pressure will also be normal. If the blood volume is increased, but the diameter of the blood vessel remains normal, blood pressure will be high. If the volume of the blood is decreased and the blood vessel is normal, then the blood pressure will be low. This may happen in the event of injury or blood loss. With decreased blood volume, the blood pressure may be too low to sustain blood flow. Specific immunity is the immune system that makes antibodies and uses them to fight certain specific pathogens that the body has come previously in contact with. Memory cells are immune cells that have the ability to recognize foreign particles that it previously encountered. The specific attachment mechanism is an antibody. Our immune system uses antibodies to bind to specific antigens. All specific immunity uses antibodies. Nonspecific immunity is our immune system that we were born with that provides generalized protection against all pathogens. This system works to prevent infection. It is the first line of defense. This graph shows how memory cells help you fight infection better. After the initial exposure, the concentration of antibodies is very low because it does take time for our body to develop antibodies for that specific infection. But you can see at the second exposure, our bodies rapidly create antibodies to fight the infection, and we are immune.
When was the last you had an infection? It probably wasn't a great worry because you know you can just get some antibiotics. But the problem is that antibiotics don't kill bacteria as well as they used to. The bacteria have become resistant. In fact, there are some bacteria which are now totally resistant to all antibiotics. This is one of the biggest threats to everyone on Earth, and the problem's only going to get worse. Unless we act fast and together, we're going to enter an era where no antibiotics work. It will be like going back to the 1930s, before they were discovered. Infections that we now regard as trivial were often fatal. Complex surgery was impossible because of the risk of infection. In fact, modern medicine depends massively on antibiotics. Did you know cancer treatment destroys the immune system? Most patients need antibiotics to survive. Imagine, no more heart, bowel, or bone operations. No more cancer treatment. This is where we're headed. But with 3 very simple steps, we can all become antibiotic guardians. Step 1, don't demand antibiotics from your doctor. We've all been there, begging for antibiotics because you feel terrible, or worse still, you're looking after a sick child. We don't need them every time we're ill. In fact, although everyday infections may make you feel unwell, antibiotics make very little difference to colds, flus, and sore throats and coughs. So ask a pharmacist about over-the-counter remedies that can treat your symptoms. Step 2, take antibiotics exactly as they're prescribed. Never save them for use in the future. Never give them to someone else. They'll work better and the bacteria are less likely to become resistant. Step 3, spread the word. Tell your friends and family to use antibiotics properly. Send them this video and share it. Antibiotics are some of our most precious medicines, and we're going to lose them unless we all become antibiotic guardians.
The female reproductive system. The ovary is the place where female reproductive cells are produced. The uterus houses and nourishes the fetus. Implantation of the blastocyst occurs here. The cervix connects the vagina to the uterus. The fallopian tube carries the egg from the ovary to the uterus. Fertilization also occurs here. The vagina connects the uterus and the cervix to the outside of the body, allowing for menstruation, intercourse, and childbirth. Milestones by trimester. In the first trimester, a zygote divides and is considered a blastocyst. The blastocyst will implant on the uterine wall. The placenta, umbilical cord, and amniotic sac develops. A blastocyst develops into an embryo around day 10 to 12. Major organs begin developing in the first trimester. The milestones of the second trimester include the fetus kicking, moving, and turning from side to side. Also in the second trimester, the fetus can survive outside of the body at the end of the second trimester. The third and final trimester, the body systems finish developing, and the fetus moves to the head-down position. The male reproductive system. The penis is the male sex organ. The prostate gland secretes a milky substance that makes up 20 to 30% of semen. The seminal vesicles are responsible for producing the majority of the components that make up semen. The vas deferens includes ejaculatory sperm, carries the ejaculatory sperm from the epididymis to the seminal vesicle. The epididymis stores the sperm and transports it from the testes. The testes produce and store sperm.